The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're delighted to have Dr. Philip Mills with us from Wichita, Kansas. Dr. Mills is a specialist in physical medicine, and today we're going to talk about joints, the joints of the body. Dr. Mills, what are the most common problems you see dealing with joints?
Well, actually, the most common problem, just about everybody sometime in their life has a problem with the back joints. And yet, because there are various kinds of joint problems, a person might ask the question, why did God give us joints since we can have problems with joints? Actually, the question is not why we have so many problems with joints. Given the complexity of the body and the joint, a better question would be, why do we have so few problems with our joints? And every part of the joint is really quite interesting. In fact, when you study the body, and I have a model of Ernest here.
Ernest? Why do you call him Ernest?
Because when I'm studying him, I'm in dead earnest. But
I see.
When you look at the model of the body and you begin to discover the wisdom of the Creator, every even bump on the bone tells an interesting story. And many times people think that their bones are just sort of stationary, these are solid, nothing changes. But in actual fact, the bones of the body are constantly being molded. And if you look at the skeleton of somebody who is 20, 30, 40, 50, 60 years, you can begin to see the story of their habitual patterns of life as well as some of the genetic aspects. The joints are quite interesting. If you want to have a lot of movement in a joint, the problem with that, you can have a lot of movement, but then you have difficulties with stability of a joint. On the other hand, if you need a stable joint, then how do you have movement? And God had to figure out all these problems, and the result is this marvelous skeleton that He gave us, part of the human body.
So which one has the least amount of stability but the most movement?
The least amount of movement, I should say the least amount of stability and greatest movement is in your shoulder.
So they probably have problems with that.
They do have a lot of problems with the shoulder, although fewer than you would think. It's very creative the way that God has done it. But we'll look at some of those problems. Another area that can develop problems for many people is in the thumb. This also has a great deal of movement. The thumb is different from any other joint in the body. And in fact, your thumb is different from any other animal. It's not only your brain that's different from the animals.
Even a monkey?
It's different from any other primate. You can do something that no other animal can do, and that is you have this type of pinch that I'm doing here. A monkey can do this maneuver, pinch like this, but it cannot do this.
Make a mouse hole.
Prehension pinch.
What do you call that? The prehension pinch.
Yeah.
Wow.
There.
Great.
Now, if you look at the elbow, there's also some very interesting aspects of movement of the elbow as well. You look at the neck, and here if you look at the neck, you find that you have greatest mobility up in the neck muscles, the neck vertebrae. They're also the smallest. And so these are the weakest of your vertebral column. If you look down at the very base of the back, you find the biggest bones here. You have the greatest strength, but you also have less movement. So these are all part of this marvelous creation of the vertebral column. If you go down to the hip joints, the hips are the equivalent in the lower extremity of the shoulder. However, because of the importance of stability, they have much less movement than your shoulder joint, but they also have much greater strength.
They kind of go in their little socket or something.
Yes. Then you come down to the knee, and I think the most interesting of all the joints. And I'd like to tell you a little bit about the different joints so that you can understand the knee.
Okay.
If you look at the hinge of a door,
all right,
that is the type of joint in your fingers. You can just go, you can move your fingers down, up and down, no other movement.
But not sideways.
You can't move the finger joints, the proximal and distal finger joints is what we call them, using the $10 words. You can't move them sideways in a normal joint.
Okay.
You also have only two movements, that is extension and flexion in the knee. However, the knee is not a hinge joint. We use a big word for the knee joint. It's called an incongruous joint.
That is a big word.
Now, what is an incongruous joint? If you look at the joint of the shoulder, you find that the arm bone, we call this the humerus bone, goes into an area that is just designed for it. If you look at the hip, it goes into an area, a socket that's designed for it.
Okay.
But in the knee joint, you have a joint that is not exactly fitting. It doesn't fit. It's called incongruous.
Is this the knee as well here, this other? Okay.
This is another model of the knee, and this has not just the bones, but it also has the
muscles, the
ligaments and other aspects of the knee. In fact, Don, if you would straighten your knee out, you would see your toe tip in just a little bit. What is happening is that the knee is not simply going like a hinge up and down, but it's actually locking into place. And the way God designed the knee is that at every position it has maximum surface area, maximum stability, and He did that by inserting between the bones two meniscus. It's called two meniscus that change shape as your knee moves. And so you have all the benefits of a congruous joint with all the benefits of an incongruous joint because it's not simply bone on bone. But go ahead.
No, you're excited about this joint. Is this the most exciting joint in the body to you?
Well, it is right now because just a week ago we were climbing up in Rocky Mountain. And my son, as we hit the summit, was struck by a blast of wind up to approximately 90 miles an hour. His foot was caught, and it blew him over and tore his knee. Now, the reason that happens, if the foot is fixed so that it cannot twist, but your knee is bending, that's where you get the meniscus caught and other aspects of the knee actually torn. So it's very important, if you're going to be moving your knee back and forth, it's very important for you to be able to have free mobility of the toes. That's why a person should never use cleats in sports such as golf or baseball or football, because the cleats keep the foot fixed. And then when the knee is bending, it may not have that little bit of play that's necessary, and thus the knee can become damaged.
So no cleats for even golf.
I wouldn't use anything that can fix my foot. My son, he got into trouble because his foot got caught in the rocks. And that's where you get into knee problems if you can't move the foot while you're flexing the knee.
Are there any other joints on the body that people have real problems with? We talked about the vertebra of the neck and of the back, and we've talked about the shoulder, and we've talked about the knee. Anything else?
Let me say a word about the shoulder.
Okay.
If you look at my finger,
okay,
you'll notice that it is straight right now.
Mm-hmm.
Now, if you look at the skin on the back of my finger, is there extra skin in play, or is it just straight?
I hope that's not a trick question.
It's not.
No, it looks like there's extra skin.
We call it redundant tissue. Now,
Okay.
if I bend my finger,
There goes the redundant tissue.
it stretches out and
Okay.
gets tight here,
All right.
but it's loose.
That's
on this
redundant
side.
on that side. Okay.
Now, in your shoulder, it has to move in many, many different angles. So that means the capsule has to be able to allow for those movements. That is, when I'm pulling it up, this would be called abducting it. That means it's being stretched underneath and not on the top.
Okay.
If I'm forward flexing it, it's being stretched from behind,
Okay.
but it's not from the front. And so sometimes the capsule that covers the shoulder can be contracted.
What does that
If
mean?
I tightened up my skin muscle right here on my finger,
The extra skin, yeah.
now I would have difficulty
Moving it.
moving
Okay.
it. And if that happens on your shoulder, we call it a frozen shoulder. And so then you have difficulty moving the shoulder.
So what can cause that? What can cause a frozen shoulder? That's kind of hard to say.
Well, there are several things that can cause it. One is just not using it sufficiently.
Okay.
And in our society, we tend not to use our joints. Every joint, every day, should have many times the opportunity to go through its entire range of motion. And because we don't do that, we try to avoid work with our labor-saving devices. We injure our joints because we don't put them through a total range of motion. So in our plan for our joint health, we should take systematically every joint of the body every day, and at least a couple times make sure they've gone through every range of motion. In the shoulder, that means putting them forward all the way to the top.
Okay.
That means in the back all the way to the back. That means out to the side as far as you can, up. And that means out to the front as far as you can. That means rotating them backward as far as you can, and rotating them this way as far as you can, down, internal rotation. And so we need to go through all of those ranges of motion in every joint if we want good joint health and protection of our joints.
Okay, so we've talked about the shoulder, we've talked about the back, we've talked about the neck, and we've talked about the knee. When we come back, I hope that you can share with us some ways to keep those joints healthy. You've started to talk about that already, and maybe we can have some practical pointers on what to do to keep them in optimal health that lasts for a lifetime. We're glad that you've joined us. We're talking to Dr. Philip Mills from Wichita, Kansas. He's a specialist concerning the joints and physical medicine. And when we come back, we'll learn more practical ways to keep them in optimal health.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Luddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Philip Mills from Wichita, Kansas. He's a specialist in physical medicine. He's been talking with us today about joints, about how to keep them in health, what to do with them, what not to do with them, and if you were with us during the first part of the program, we had an anatomy lesson and a physiology lesson about how these things work, and it's really wonderful to see how the Lord has designed our bodies. But Dr. Mills, I have some questions for you. Let's just go through your skeleton again, and I want to ask you some questions. Maybe we can just go back and forth. When you're looking down here at the fingers, what happens if, for instance, your finger locks up? I've heard of people having their fingers lock up. What should you do?
It's a common problem, Don, and we call it trigger finger. And often, if you feel in the palm of the person's hand, you can feel a little nodule. You see, joints don't exist independent of muscles and ligaments. And there's little pulleys, the ligaments that go from the muscles into the fingers, and they run through protective tubes. Now, if this pulley, because a person has been using it repeatedly, it gets a little irritated, it may develop a swelling. Okay. And so it pops into that tube, and then it pops out. And in that process, we call that a trigger finger. First thing you do is quit using that joint until the swelling goes down.
And how do you know when that swelling's gone?
Well, it'll start working again. But you do not want to exercise through that, because that'll just make that problem worse, the swelling and problem worse. If just stopping exercise, the rest doesn't solve the problem, then you have a little injection of a cortisone into that pulley.
Okay.
And if that doesn't alleviate the problem, in some cases there may need to be actually a surgical procedure to take care of that nodule.
What's that called?
Surgery.
Surgery, okay. It's not a special name for that.
Well, yes, they have special names for everything. But the point of it is in virtually all cases a fixable problem.
That's good news.
Either by rest, by injection, or by a surgical procedure.
What's carpal tunnel syndrome?
Carpal tunnel is not really part of the joint. It is where the median nerve is pinched there in the wrist. But that's another whole topic.
All right. What about moving up here? What about elbow? I mean, I might sound naive, but is tennis elbow a problem you deal with?
The most common problem in the elbow is actually tennis elbow. And tennis elbow is a degenerative type or wear and tear kind of problem with the muscle insertion into the bone.
So where the muscle hooks into the bone?
Hooks in, yes. Okay. We call it you like those $10 words, the enthesitis.
Enthesitis.
Yes.
Boy,
but all it means is there is a problem where the muscle becomes a tendon and then hooks into the bone. And it begins to pull away slightly.
And that's where the pain comes from. But that's not really a joint problem then, is it?
Well, it's around the joint. What you find is that it may come on with a person that's squeezing out a mop. He may not be used to this, or he may be doing it all the time, squeezing out a mop or squeezing out a dish rag,
putting a screw in.
Screwing in a screw. Or it does happen with people playing tennis where they're
when they put that
gripping, they have the tight grip. I've seen it also with surgeons that are having to have a tight grip on instruments. But the problem is the muscle is slightly pulling away.
How do you treat it? What do you do for it?
Well, first, there are a lot of different treatments for it, and that means that none of the treatments are ideal. the prevention is to be in just general better health.
I see.
And avoid the degenerative problems. But the first thing that many do, and that I do, is I'll rest it for a very short time.
Okay.
And then once it's pain-free, then I try to get it in condition by appropriate exercises through physical therapy.
I see.
And then you go from there if those simple treatments don't work.
Well, let's move up here next to the shoulder.
If you have a frozen shoulder, and that's probably the only thing that we'll talk about today, but a frozen shoulder where your shoulder is pain-free, except when you move it. And you move it into a certain position, and then you have
real pain.
Real pain. And then as soon as you quit moving it, the pain goes away. Often, that frozen shoulder, that is frozen shoulder, and that is treated very aggressively. It can be cured by, surprisingly, stretching. Now, a person does not hurt themselves. If this hurts for a individual to move their arm in this position, they won't do it.
Yeah.
And so you have to have a therapist who really understands and a physician who will order it not once or twice or even 3 times a week. It needs to be every day for a couple weeks, and within 2 weeks you'll feel some significant improvement if it's truly frozen shoulder, and then you can go to a less vigorous
So what do you do?
treatment.
How do they move that shoulder? And it's a physical therapist that does that, I assume.
Yes, you have to have somebody else do it because you won't tolerate the pain.
And they move it. How do they move it? Up and down, any place?
Well, there's some specific important exercises.
Not something you should try and do on your own.
No. This is something that you have your physician send you to a physical therapist, and the physical therapist stretches it out. And again, they may even have to be stretching out those adhesions that we talked about earlier that may be present, and stretch the capsule. And within a short time, you may have much improved range of motion and much less pain.
So don't just give up on it. Make sure and take care of it.
It can be treated, and it can be treated very effectively.
Okay. What about down here? We talked about the knee.
Well, in the knee, the important part to remember about the knee is that you not only need to have good, strong ligaments, but you also need to have muscles that are strong, and not only on the top, we call those the quads, but also on the bottom, the hamstring muscles. Both of those need to be in balance. And in a good exercise program, where if you're having knee problems and you have an exercise program, it is important for you not to just exercise one or the other, but both of them need to be exercised.
So by
and
walking,
strong.
by jogging, is there any harm in jogging, running? What should we do?
In a person who is otherwise healthy, under 40, and has no arthritic problems, jogging is an excellent exercise. If a person is over 40 and doesn't have any arthritic types of problems, jogging may be a good exercise program for them. But walking is safe for everybody. And so I can, without hesitation, recommend a walking program. Now, many people are concerned that in jogging, you're going to put stress on your knee. But as long as a person is not fatigued when they're running, in fact, you are hitting without the knee being extended. You're hitting in a slightly bent position, and the forces bypass the knee.
So it's not really affecting the knee at all unless you're very tired. And how do you know if you're very tired?
If you're fatigued, if you begin to start striking with the knee extended, then that's harmful, and you shouldn't be jogging in that case. And if a person has an underlying arthritic problem, they may need to avoid the jogging as well. In the case of an arthritic problem, a severe arthritic problem, and if they still need to exercise, and in that case they may need to exercise in a pool, aquatic type exercise. The other thing that they can do is to use a cane on the opposite side of the knee or hip problem.
So don't use the crutch or the cane on that side, or maybe not a crutch at all, on the opposite side.
Yes.
Okay.
And a physical therapist can get the cane at the proper length, and it can also instruct in a proper walking style.
These have been very helpful tips, but I don't want you to leave without addressing another thing. I know that you are a physician, and one of the reasons you're a physician is because Christ was a physician. What lessons have you learned in studying the bones and helping people with these joint types of problems? What spiritual lessons can you share with us as we close out?
The first lesson is that we have a wonderful Creator. We
That's
are
right.
fearfully and wonderfully made, and the more I study, the more I am impressed with how He, every time I move my joint, I can be grateful to a God who was so thoughtful to design it in such a useful way to me. There's another lesson that I've learned, and it's found in Galatians chapter 6, verse 1.
Okay.
And it says this. It says, Paul says, "Brethren, if a man is overtaken in any trespass, you who are spiritual, restore such a one in a spirit of gentleness, considering yourself, lest you also be tempted." Now that word restore actually means to put it back in joint. It's the orthopedic word in Greek for putting
Reduction.
it in proper position, reducing it. If a person comes into the emergency room and he's just injured his shoulder, let's say it's been pulled out of joint, no one stands around and criticizes that man and says, "Well, you made your bed, you better go walk in it." What they do is immediately come to his aid and do for him what the person isn't able to do for himself. They try to restore that joint. And all around us we see people who are out of joint, out of relationship with God and with their fellow men. And our job is to be spiritual orthopedists, whatever our profession, and restore these people, as Paul says, in a spirit of gentleness, considering yourself, lest you also be tempted.
What a practical lesson and a spiritual lesson, and I would like to hear more stories about patients who you've been able to help in those situations. We're thankful that you've joined us today. We've been talking with Dr. Philip Mills from Wichita, Kansas. He's a specialist in physical medicine, and we've been talking about joint pain. We've been talking about the things that many of us will experience sometime in our life. And we hope that as a result of today's program, you've found information that can help you not only protect these valuable assets, your joints, but also can help you assist others in a spirit of gentleness so that you and they can have health that lasts for a lifetime.